All right, so finally on the discharge 123, we're ready to discharge the patient, we're ready to get the patient going home. There's two different ways that you can discharge the patient. Everybody has their own little differences. Basically what you want to do is you want to select the patient that is going to be going home. And then from here you're going to be actually clicking this little Windows session management button right above the hammer. And basically what that does is you want to open up your magic key window. From the magic key window, you're going to be able to click this and it's going to basically launch discharge 123. So basically it will automatically load in the patient information from here. You can also select a new patient, but I wouldn't recommend that just because there are a lot of patients that are named very similarly, and so using that magic key will allow it to link up appropriately for that patient. Now, for the discharge instructions, there's a couple different things that we need to put in and a couple different nuances here. Basically, I particularly just find that the find button is the best way. You can go to cardiovascular, you can go to dental, ENT for otitis media, but it seems like find is the easiest way to go about getting through to a certain diagnoses, perhaps. So for here, you can just type in otitis, and it'll pull up again multiple different types of from pediatrics to regular. The difference between this otitis media and this otitis media is exactly identical. It's just under different categories. So if you look at 1071, it's the same exact instructions. A lot of people have questions on that, but again, obviously the pediatric one's a little bit different. So you basically can select that diagnosis, and once you select that diagnosis, you'll be able to select either in Spanish or in English. Basically from selecting from here on out in Spanish or English is going to dictate how the discharge instructions are going to be printed out. So in Spanish or English, the prescriptions, the prescription instructions for the patient, things of that nature. So, for example, you can actually click or unclick. This is most otitis media get better over 2 to 3 days, etc. Take the antibiotic as directed and finish the whole prescription. Well, let's say I don't want to give them an antibiotic and I don't think they need it. You can unclick that or do whatever and then edit when you put it actually within the note. So I'm just going to paste this in there as is. And then basically you also want to put in your tests. Again, this is all for meaningful use. So again, if you got a CBC or, again, I know it's for otitis media, but if you got a UA, there's basically 3 different options you have. It's either completed, it's either abnormal, or pending. And so, again, if CBC, completed, even if the platelet count's, 110, 110,000, I mean, it's not that far off. Again, depending on the clinical picture, we didn't want to say it was correct or perfect in terms of that, so that's why we did that. But again, you can put different CBCs that your analysis is complete or abnormal, and so we can give them that. And let's just say a blood culture would be pending, right? And so all I'm doing is I'm just clicking multiple times, circulating through from complete, abnormal to pending. And you can paste that in. You can put in other things in terms of your x-rays, in terms of whatnot. And so see, it's complete, abnormal, pending. Now, in terms of follow-up, again, you're going to obviously want follow-up for all of your patients. You can type in anybody. You can type in different clinic. You can type in PD place. You can type in a certain spine physician. You can give them the duration. We normally just call for appointment or a schedule. Normally, we don't like to do just medical legally. It's good to have actually an endpoint for that in 2 to 3 days or something of that nature. And again, you can paste that in. The one nice thing that recent upgrade as well is that, let's say, for example, you want them to also follow up with, let's just say Dr. Rhodes, for example. So it actually will specify on the discharge instructions that, orthopedic surgery. Initially, so if you have an orthopedic surgeon and a spine surgeon and a trauma surgeon and a neurologist and everything, it'll put in who all's who, which doctor is which to follow up with in terms of that. So like I said, since we're in English, it's going to continue on in English. For here, you can actually just start typing in the prescriptions if you want to, so Norco or things of that nature, and you can double click. Again, these are the defaults. You can obviously change whatever you'd like. For controlled substances, the DEA should be already clicked out, but let's say, for example, you really only want to give this person 12 pills of Norco, that's fine. And again, you can just change that by typing in and typing 1, 2, and then OK, and I'll move it to 12. And again, as you can notice, the DC instructions, this is for the patient. So, and then basically if you want to choose like another one, you can do alpha choose again. And it's thinking. And so you can do like amoxicillin, and so you can do all sorts of different things. Now, if you want to add a blank prescription, for example, we don't have a Ralgan. We do have a Ralgan with Abiotic. We have all of $4 medications on there and stuff like that. Well, let's say they just, for some reason, you can't find Abiotic or you just can't do it. You can actually type it in. And again, all this here is what is going to be on the prescription. The DC instructions is what goes to the patient. So make sure that whatever you type in here is going to be, is going to be what the pharmacy says. So again, instructions here, as package insert, refill 0, and then that basically adds your prescription in there as well. You can add up to 8 prescriptions in one discharge instruction, and hopefully they don't need more than 8 prescriptions. In terms of excuses, you just hit your excuse button. If they were seen today, you can excuse them from today till tomorrow or however long you want to do it, whatever duration. And then from work, you can edit whatever you want from swimming or whatnot as well. And let's just say from school or something of that nature. That's fine. And again, that puts that in there. And then basically you can put patient may return on 7/26/2014 without work restrictions at that point. And so that's something that you can either type here, or again you can also go under limitations, and basically under limitations it will show you no lifting of greater than 20 pounds or things of that nature. It will show by each limb or extremity or certain task the limitations that the person can do, and then also it will do it by duration. The limitations are set at a standard 7 days. You can adjust that. So as I was talking about before, here's your limitations for work. You can increase or decrease in terms of that. Upper extremity, lower extremity, general, avoid lifting, for how long. You basically just select the item. You can edit this, avoid lifting greater than 10 pounds or something of that nature. And then again, you can just hit OK paste within that area. A couple other things, and then once you're done, you basically just want to hit complete and discharge. It depends on how you log in. Sometimes this will just be complete discharge with print, and you'll just automatically print. Most of our scribes will have a hold function. So like if you have a person that has an ear infection that you're most likely going to discharge with otitis media, or most likely is going to go home, you can actually put it in hold status. Additionally, let's say, for example, that you created a discharge instruction and you completely did the wrong patient, and it was a left toe issue and the person had a right hand injury. You can actually load that patient back up, redo the instructions, and it will overwrite those discharge instructions that were done wrong during that time. So, and then as we were discussing as well, hold is, I personally like the hold function. Like I said, I load discharge123 outside of Meditech and EDM, so I can hold certain things. But again, that's going to be something that you can figure out your best practice. But most of the time, you're going to be doing discharge and clear. This is going to print the patient out and with all the prescription paper and get things going for the patient. The two last things I wanted to show you on discharge123, we'll do a new patient here, is one is if you retrieve a discharge, you can actually, again, if there is one that your scribe typed up for you, you can click on them and select the patient, and pretty much everything should be pulled up. You can go to your prescriptions and write in the prescriptions that you want, print them out, but the scribe can put all the discharge instructions, follow-up, excuses. You just got to fill in the prescriptions and you're ready to go. And then the one other thing that I wanted to talk about in terms of Spanish for discharge instructions is going to be, so again, going back to the good old otitis. I just love otitis media. Whenever you select and whenever you switch over to Spanish, you want to paste both Spanish and English. The reason for this is that we want to make sure that when our nurses are giving discharge instructions to the patient, that they are basically translating the English into Spanish for them, and so that our nurses, as well as other ancillary staff, know what we're giving the patient and what's going on. So that's why it does that. But this Spanish button basically will dominate everything beyond what is coming forth. And basically, like I said, we'll be able to see that on the prescription area. So you can see how it's in Spanish here, and then as you scroll down to the bottom, it'll be also in English for the nurse to read. So, and as I discussed on, let's just pick Augmentin just for the sake of argument, you see how the discharge instructions are all in Spanish as well here. So, but again, this is all in English for here, for the pharmacist, and again, this is all for them. So, and then the last thing that a lot of people were wanting to have was the Tylenol and the Benadryl and Motrin charts. So I know it doesn't look very pretty here, but when it prints out, it does print out nice and straight, and it basically will adjust. It will print out a nice table for parents to use at home for that.